name is Steffi Monk, and my kids take steroids. And I'm sure many of you have taken steroids too. When my kids get the croup, their throat swells shut, and the doctor prescribes them a steroid called Decadron, and that opens up their airways. Also, people with asthma use steroids to open up their airways. So if steroids are so helpful, why shouldn't athletes be able to use them to enhance their performance? Well, today I'm going to tell you why athletes should not take steroids to enhance their performance. Steroids give athletes an unfair advantage. They also have harmful or deadly side effects, and taking steroids to become a better athlete gives youth the wrong message. Now, our body naturally builds muscle, so when we take steroids, we bulk up really quickly. And that's really unfair to the athlete that doesn't take the steroids. In 1992, David Fairchild declared the use of performance enhancers is cheating. And in 2009, Coach John Slading complained that many of the 19 and 20-year-olds looked like they were 35-year-old men due to steroid use. However, some critics would argue that in order to have an equal playing field, the athletes that don't have natural ability should be able to use steroids. But in 2001, Michael J. Beloff maintained that if steroids are made illegal, success will be determined not on the field, but in the test tubes. The use of steroids not only gives an athlete an unfair advantage, but it puts an athlete in danger of harmful and deadly side effects. In 1989, Dr. Gary Wadler warned that side effects may not present themselves for months, years, or decades after they've been taken. Some side effects associated with steroids differ from men and women. For instance, men may experience breast development, pain while urinating, and reduced sperm count, while women become more masculine. They get facial hair, voice changes, and changes in their menstrual cycles. Steroids may enhance your performance for a time, but it's only a matter of time before your health declines. The third and final reason athletes should not take steroids to enhance their performance is the message that they're sending the youth. In 2006, the University of Michigan conducted a study on the use of steroids in youth. This graph shows you the results. The sophomores are in green, and the seniors are in blue. In 2003, 1.7% of sophomores admitted to taking steroids to enhance their performance. Fortunately, you can see a decline for the sophomores. In 2004, it drops to 1.5. In 2005, it drops to 1.3. And in 2006, it drops to 1.2. The seniors, however, are a different story. In 2003, 2.1% of high school seniors admitted to taking steroids to enhance their performance, and it jumped in 2004 to 2.5%. Now, fortunately, in 2005, there's a significant drop to 1.5% of high school seniors. But in 2006, it jumps up again to 1.8. Now, the question is, why are the sophomores declining while the seniors are spiking up and down? The answer to that is that high school seniors are looking for their future. They're trying to get scouted by colleges and professional athletes. And if they're not as naturally talented as the really good athletes, they might turn to steroid use. They also look to professional athletes and model their training. Barry Bonds had 272 home runs in his career, and Marion Jones won 3 gold medals and 2 bronze medals in the Sydney Olympics. Bonds and Jones are world-celebrated athletes, and the youth of today are looking to them for guidance in how they train and perform. Unfortunately, both Bonds and Jones have tested positives for steroids while playing sports. Another reason we see an increase in steroid use, as Charlie Reese suggests, is Americans are obsessed with winning. Sportsmanship, endurance, hard work, and honesty are much more important life skills for the youth, and that's the message we should be presenting. Winning is only important when it involves your life. For those of you invested in sports, this topic should give you something to think about. Is keeping the playing field equal important to you? Are the side effects worth the risk? What's the message that you want to present to the youth of today? Because they are looking up to you. Does anyone have any questions? Yes.
So how do young athletes get steroids?
That's a good question. Young athletes are around trainers, coaches, medical doctors. They are really invested in this athlete. They are generally the ones that supply the youth with drugs. In fact, Marion Jones claimed her coach gave her steroids. And she was told that it was flax oil, which is just a supplement. Many people agree that medical physicians and physical trainers should not have the power to give drugs. But unfortunately, it's the athletes that are the ones faced with the consequences. Any other questions? Yes.
What are other side effects of steroids?
Very good question. There are lots of other side effects of steroids. There is, for men, there's balding and sperm count reduction. It shuts down your liver. It causes heart attack and stroke. In fact, Ken Caminiti died of a heart attack due to steroid use. Any other questions? Okay, thank you.